Continuing with Objective 3, now we're going to define, pronounce, and spell disease and disorder terms related to the digestive system. So, like always, we'll start with the terms built from word parts. Appendicitis, inflammation of the appendix. Cholangioma, tumor of the bile duct. Cholecystitis, inflammation of the gallbladder. Cholelithiasis, condition of stones in the common bile duct. Cholelithiasis, condition of gallstones. Colitis, inflammation of the colon. Diverticulitis, inflammation of the diverticulum. Diverticulosis, abnormal condition of having diverticula. Enteritis, inflammation of the intestines. Esophagitis, inflammation of the esophagus. Gastritis, inflammation of the stomach. Gastroenteritis, inflammation of the stomach and intestines. Gingivitis, inflammation of the gums. Glossitis, inflammation of the tongue. Hepatitis, inflammation of the liver. Hepatoma, tumor of the liver. Palatitis, inflammation of the palate. Pancreatitis, inflammation of the pancreas. Peritonitis, inflammation of the peritoneum. Polyposis, abnormal condition of multiple polyps in the mucous membrane of the intestine, especially the colon. Proctitis, inflammation of the rectum. Rectocele, hernia of the rectum. Sialolith, stone in the salivary gland. Steatohepatitis, inflammation of the liver liver associated with excess fat, often caused by alcohol abuse and obesity. Over time may cause cirrhosis. Uvulitis, inflammation of the uvula. So here, they're just showing you two disorders of the gallbladder and common bile duct. So here they are analyzing it for you, separating it into word parts. So we have cholelithiasis and choledocholithiasis. Can you name a disease or disorder term that makes use of the combining form polypo? And so here we have polyposis. That was one of the terms that we just went over. Which of the following is the term that means inflammation of the anatomic structure of the mouth? So first of all, you need to know what is part of the mouth. Well, hopefully proctitis, you remembered that that is not part of the mouth. So you can eliminate that one. Esophagitis would be the esophagus. Proctitis, of course, would be the rectum. And so hopefully you answered B for uvulitis, because that's the little thing that hangs down in the back of your throat. And then we have diseases and disorders not built from word parts for this chapter. So again, just take a little bit more time to learn them. Adhesion, abnormal growing together of two peritoneal surfaces that normally are separated. Celiac disease, malabsorption syndrome caused by an immune reaction to gluten, a protein in wheat, rye, and barley, which may damage the lining of the small intestine that is responsible for absorption of food into the bloodstream. Cirrhosis, chronic disease of the liver with gradual destruction of cells and formation of scar tissue, commonly caused by alcoholism and certain types of viral hepatitis. Crohn's disease, chronic inflammation of the intestinal tract, usually affecting the ileum and colon, characterized by cobblestone ulcerations and the formation of scar tissue that may lead to intestinal obstruction. Gastroesophageal reflux disease, GERD is its abbreviation, and they pronounce it GERD. Abnormal backward flow of the gastrointestinal contents into the esophagus, causing heartburn and the gradual breakdown of the mucous barrier of the esophagus. Hemochromatosis, iron metabolism disorder that occurs when too much iron is absorbed from food, resulting in excessive deposits of iron in the tissue. Can cause heart failure, diabetes, cirrhosis, or cancer of the liver. Hemorrhoids, swollen or distended veins in the rectum or anus, which are called internal or external respectively, and can be a source of rectal bleeding and pain. Ileus, non-mechanical obstruction of the intestine caused by a lack of effective peristalsis. Intussusception, telescoping of a segment of the intestine. irritable bowel syndrome, periodic disturbances of bowel function such as diarrhea and or constipation, usually associated with abdominal pain. Obesity, excess of body fat, which increases body weight, a condition in which body mass index or BMI is greater than 30 kilograms. Overweight is defined as BMI between 25 and 29. And then morbid obese is BMI over 40. Peptic ulcer, erosion of the mucous membrane of the stomach or duodenum associated with increased secretion of acid from the stomach, bacterial infection, or medication such as non-steroidal anti-inflammatory drugs. Also could be called gastric or duodenal ulcer. Polyp, tumor-like growth extending outward from a mucous membrane, usually benign. Common sites are in the nose, throat, and intestines. Ulcerative colitis, disease characterized by inflammation of the colon with the formation of ulcers which can cause bloody diarrhea. A proctocystectomy with permanent ileostomy may become necessary if the patient doesn't respond to medical therapy. And volvulus, twisting or kinking of the intestine causing intestinal obstruction. And so here they're just asking the name of this disease, and it's going to be a peptic ulcer. And that will end this recording